Hey guys, today we're going to show you how to apply an AO splint. These are the supplies you will need: a container for water, several rolls of 4-inch plaster, 4-inch web roll, and a double 6-inch ACE wrap. We start by having your assistant hold underneath the knee and support the patient by their toes. We then wrap the web roll tightly around the distal aspect of the foot, ensuring to make no wrinkles in the web roll. We make a nice cuff here and then continue proximally. As we approach the ankle, I typically go around the ankle, as you know you're going to come back and pad this later. We continue wrapping proximally with about 50% overlap. At this time you may have to tear the web roll some to get it to lay down flush, but it's important to make sure there are no wrinkles, as this can lead to pressure points in the skin. We continue all the way proximally and make a nice cuff at the proximal aspect of the splint, as seen here. At this point we start padding the heel. I use a heel pad made of several layers of web roll and tack this in place in a figure of 8 fashion. We then go back and add additional padding on both sides of the ankle, as well as posteriorly over the Achilles tendon. Now that the ankle is adequately padded, we're ready to apply our splint material. I use a toe plate, again made of several layers of web roll. This is held in place by the assistant over the toes, and the assistant also holds the posterior aspect of the splint in place. We tack this down with one layer of web roll around the proximal leg and one around the foot. You're then ready to apply your stirrup portion of the splint. Again, this is held in place by the assistant, and at this point we take the web roll and completely cover the plaster splint material. This ensures that it does not stick to the ACE wrap and makes it easier to take off for the next person. Again, it's important here to make sure that none of the plaster is bunched up and that everything is laying smoothly on the skin. Now we need to apply our ACE wrap. We do this by starting wrapping one time around the ankle. We then go around the heel and over the assistant's hand. Then come distally around the bottom of the foot. Then once more proximally and around the heel. And then finish the remainder of the ACE wrap going up towards the proximal aspect of the splint. At this point, you take the extremity from your assistant, supporting the foot on your chest, and take this part of the ACE wrap and fold it over your foot plate. Be sure that all the patient's toes are exposed, and you can release the web roll over the dorsum of the foot to make it more comfortable. It's at this time that you apply your mold if one is needed, being sure to use your chest to dial in the correct amount of dorsiflexion as dictated by the fracture. Once the split is dry, I like to release the proximal web roll to make it more comfortable on the patient and fold these ends of the ACE wrap underneath. This also ensures that none of the splint material is touching the patient's leg. And that's how you apply an AO splint. Here's several examples of what they should look like when they're complete. This video is brought to you by Pimped Orthopedic Surgery.